Hi, ladies and gentlemen. I'm Lieutenant Governor Spencer Cox, and I'm excited to have this opportunity to answer some of your questions regarding the state's response to the coronavirus and the COVID-19 disease. But let me begin by thanking all of you for your incredible work, academic work and otherwise, during this crisis. I know that this semester did not go the way that you had anticipated, but we certainly recognize your sacrifice, and we're grateful for the sacrifice of Utahns everywhere as they have responded in just the best ways possible to this pandemic. I want to give a shout out to those seniors who are finishing up their year. I know that this graduation was not what you expected at all, but I can say that it is one I'm sure that you will never forget. Thank you for what you have done as you have learned at UVU, one of our state's best and an institution we are just so very proud of. Your education will serve you for a lifetime. And to the underclassmen who are watching this, keep working, keep pushing. It's not ideal to be taking classes online or watching videos like this, but it's great to see your education continuing, and we're excited for what the future holds for you. Now, let me jump into some of these questions, and let me start with an apology that because of a limit on time, I won't be able to answer all the questions, but we have tried to select a question from each class to answer. So, here is our first question. It comes from the Comms 431R, the Executive Lecture Series. It reads, what has it been like, a day in the life of a leader like you navigating this crisis? Well, much like your days have changed, so have mine and so have ours. Honestly, it's unlike anything I've experienced in my career or otherwise, and it's really come in waves. Of course, in the very beginning, on March 2nd, the governor appointed the coronavirus task force here in the state of Utah, asked me to lead that, much like the president appointed the vice president to run the federal task force. We pulled together the best and brightest. We started having meetings and started planning ahead, and then the crisis came in that first big wave, most notably when one of the Utah Jazz players, Rudy Gobert, tested positive, and that was kind of a shifting, not just here in the state of Utah, but across the country. And from that moment on, our entire lives became consumed with dealing with this crisis. Every night is a late night, every morning is an early morning. And what we were doing was trying to bring together the right people and ramp up a response that we would normally take 6 months to a year to do, and we had to do it in a matter of days or sometimes even hours, and those hours often felt like days as we learned more about the virus. One of the problems with this response was there was so little that we knew. Of course, we had data coming in and information coming in from China and then from Europe and Italy and other places that were being hard hit, but we knew so very little about the virus itself, how it was transmitted, and testing immediately became a problem. And so our focus became on supply chains at that point. How do we ramp up testing? How do we get the supplies from testing? There was a limited number of tests available. Then there was a limited number of the reagents, the chemicals needed to extract the RNA from those tests. Then there was a limited number of swabs available to get a sample from a person that could be tested. We ran into problems, as has been noted, with personal protective equipment. How do we find enough masks and gowns for our frontline workers, the things that they desperately needed? And all of this was happening in real time, and recalling that it's not just the state of Utah, but every state in the nation and every country in the world that was dealing with the same problems. And the good news for us as leaders is that we have incredible people here in the state of Utah, people that are always willing to step up in a crisis. And we actually have a different problem than most states. In most states, they're trying to find people to help. In our case, we have so many people that want to help, and how do we use them in the right way? Over the course of days, we were able to stand up an incident command structure that reported every morning at 8 o'clock in the morning, and every afternoon at 4:30 we would have reports from different groups dealing with these subgroups. So we immediately organized an economic recovery task force. We dealt with every single problem, a testing task force, a PPE task force subgroup. We, things like childcare for our frontline workers. So many people involved, and then there's the communication piece. An important part of leadership is just communicating, and communicating directly and succinctly, helping set the tone for people. And when there's a vacuum of information, that vacuum always gets filled, but usually gets filled with bad information. Any good comms class understands that. And so how do we communicate? We brought in our PIOs from every different organization in the state, every different agency, brought them in to work on this crisis, to coordinate together, to make sure that our messaging was on point. We wanted to be able to reach out to the public, and so we immediately brought on a team to work on those messages. You've seen billboards, you've seen ads about what is happening with the virus and what the expectations are for the people of the state of Utah. Of course, we use social media. I even started doing kind of a spin on the fireside chats that were common back in the Great Depression, and I started doing what someone affectionately called bookside chats. I do it at my house next to some bookshelves, and really just communicating directly with people, helping them to stay calm but also have good information. So every day is different, but they're all very, very long. They include a lot of Zoom calls and a lot of efforts to communicate better with each other and with the public. So hopefully that's helpful. Let's move on to the next question. This comes from Comms 350R, the Health Communication and Culture class, and it asks, are there any considerations for health disparities and racial ethnic groups who may be disproportionately impacted by COVID-19? So when we began our response to this virus, again, it was an all hands on deck, protecting all Utahns, but we started to get some news out of New York, and then I think it was Detroit, where we started, there were the first reports as the disease had progressed further in those areas, that there were disproportionate impacts on multicultural minority communities. And we asked our Department of Health to do some studies around that, to pull the data and see what they could find. And as they did that, unfortunately, we were seeing some of those same trends here. Specifically, the Latino population, which is the largest multicultural community in our state, as well as we did know very early on that our Native American communities, specifically the Navajo Nation in Arizona, was seeing big numbers, and that was bleeding over into Utah. And so that was one area where we immediately put resources. We put some mobile testing sites down there. We reached out to the president and vice president of the Navajo Nation. We're working with them. But as far as the broader community, we wanted to do more. Now, I also serve as the chair of the state's multicultural commission, where we work on issues surrounding our ethnic groups and multicultural groups. And one of those that we work on is our health disparities and improving health disparities. We have several programs going on right now with IHC to work on making sure that we can solve some of those health disparities. But we realized that this was an acute problem. And one of the problems is that as we were distributing information, we were translating it with the help of the National Guard and others into I think 14 different languages. But just because we were translating it into those languages didn't mean that the information was actually getting out to the people who needed it. And so we put together another subgroup task force, a multicultural task force, using the leadership from our multicultural community commission, as well as the Martin Luther King Commission. And they sent out surveys throughout the communities to find out what was happening out there. Again, we're trying to get better information about why those impacts are happening. Some of the initial areas that we know are that many people in our Latino community work on in grocery stores and essential businesses that were open, and so putting them more at risk. We also recognize that many times those that they don't have the information on where to get tested or what to get tested for, what the symptoms look like, and how to social distancing. So they just weren't getting good information. But then if they did test positive, they often aren't able to quarantine. Many times you'll have multiple families living in one house, and so the infection would move from person to person within that household. And so we're working with the local health department to provide alternatives. We have hotel rooms where people can go for 14 days to quarantine if they don't have the ability to do that in their homes. And so this group is working directly with those communities and trying to mitigate those disparities that we're seeing across the state. Great question. The next question comes from Comms 2115, Introduction to Health Communication. It asks, we as a community, state, and country are starting to see a clash of individualistic and collectivistic belief systems regarding the social distancing and stay-at-home mandates versus individuals who see it as their right to protest and not follow such rules. What is some advice that you can provide to constituents that we can share with others to encourage loved ones to stay at home and engage in social distancing? One of the incredible question, by the way. One of the things that troubles me most about this virus and our collective response to this virus is to see us falling into what apparently now is all we know as communities and as people, and that is to politicize everything. We've certainly seen that. Obviously in politics, the divide, the toxicity that's driven our nation and just gotten worse and worse over the last 10 years and continues to worsen. This tribalism, I speak often about it. It's something I'm passionate about, trying to overcome our tribalistic tendencies that continue to plague us. We're more divided as a nation, at least politically, than at any time since the Civil War. My background is in political science, and political science are pretty unified on this one, that we see those camps really dividing. And usually tragedy or crises bring us together, and we've certainly seen some of that, don't get me wrong. And I think it's important to note that if you actually look at the polling data that has been done around the actions that have been taken by the state of Utah and other states, by and large, most people are very much in agreement that these are important and that these are good things. But confirmation bias is an incredible drug, maybe the most powerful drug we have. And what I would very much encourage people to do, if you were in the camp that this is that this is no worse than the flu and we shouldn't have done anything and we've completely overreacted to this, I would encourage you to look for other voices, voices of epidemiologists and experts that can explain in very stark terms, in very real terms, using actual data, why this is so much more dangerous than the flu, and why what we haven't done, what we have done isn't necessarily an overreaction. Although again, there are certainly mistakes made as we learn more about this and have a better understanding about where we're going. Conversely, if you're in the camp that can't understand why people are upset with these stark measures that have been taken, I would encourage you to try to empathize and understand the extreme damage that has been caused by the decisions we've made around social distancing and otherwise. The economic damage, which is very real, as millions of people have lost their jobs and many lost their companies and their dreams overnight, and to understand the health issues that come with that, and the stress and the anxiety. Certainly, we know we have seen rises in mental health issues. We have seen a rise in domestic violence, and then an understanding and a concern about an erosion of civil liberties. Oftentimes, there's a kind of a lack of understanding about what is constitutional and what isn't. And of course, from the very beginning, the idea that health impacts can be used to impose these types of measures on people. George Washington did it. It has been done, again, as pandemics have happened throughout the course of U.S. history, and certainly was included and understood in the founding documents of our founding fathers and continue in law today. However, that being said, those can be taken to extremes where privacy is violated and people feel like they are losing their rights. And that is a very, very valid concern, and one that should be taken into consideration by all of us. And so let's try to get outside of ourselves. We live in a world where it's very easy to surround us with only voices we want to hear and to confirm the biases that we have. With social media, with cable news, we can pick our sources that make us, that confirm everything that we believe, and we never have to hear an alternate voice. And I would encourage all of us to always look for those alternate voices. I do that every day. I read media sources from conservatives, media sources from more moderate areas, media sources from the liberal side, and trying to get a good understanding of what's really happening out there. We've lost our shared facts as a nation. And it makes it very difficult to have a conversation without talking past each other when we don't have a set of shared facts. And so I would encourage all of us to understand the voices from the other side and to find truth where it exists, and then to jettison the lies that are clearly out there and the mistruths that we see far too often. Finally, I would just say this. We would never destroy the economy for I can't think of any reason we would want to do that. The decisions that have been made by the governor and legislative leadership and others as recommendations from our task force have been put forward have been in the interest of doing both things. One, preserving health and safety, and second of all, also restoring our economy and being able to encourage economic activity. We've just moved from the red phase into the orange phase, the moderate phase, but that only works if we take these precautions. And so to finish answering the question, we really do need to understand that if we want to have economic opportunity, if we want to get back to normal, we're going to have to do some things in the meantime, and they should not be political at all. They should be part of our willingness to help improve, to protect ourselves, but also to protect our loved ones and others who may be struggling. So we need to wash hands. We need to stay 6 feet away from people as much as possible. We need to wear masks in public. This should not be a political issue. Now, one of the things that's important here in Utah is we are one of 7 states that did not have a statewide lockdown order. But we had people who were doing it anyway. And that's true of masks and other things. While we're not requiring it, and some businesses may require it, again, this is not trying to take your freedom away in any way. This is really about helping us not if we're asymptomatic, not spread that virus to other people who may be vulnerable. We can do this. We can do this together, and we can build a stronger nation and a stronger state because of it. So thank you for that question. Okay, let's go on to the next one. This is a question from Comms 3140, social media content creation. What role has social media played in helping Utah officials manage information and or disinformation? One of the very first things we did, even before we made announcements about closing schools and universities or not having people eating in restaurants, was we recognized that social media was going to be critical. I can tell you in my involvement in public service. My understanding of social media actually started many years ago, about 8 or 9 years ago, when we had a massive fire in our county. I was county commissioner at the time, and the federal government was kind of overseeing the response to that fire, and their idea of communicating with the public was putting out a press release every morning at 8 o'clock. In today's world, that is not an option. That is not how we communicate. And so my social media feed, Facebook and Twitter, became kind of the de facto response to the public. When rumors were swirling about a town being evacuated, I was able to use that to put down those rumors very quickly. Conversely, when we needed to evacuate a town, it was social media that made it happen. I remember having a neighbor across the street who needed to evacuate, who found out he needed to evacuate from his daughter who lived in Indiana, who was following my Facebook feed. And so it's amazing the way we're able to communicate now. So very early on in this process, we set up social media feeds for the coronavirus. Hopefully you've been able to follow those. We set up a website, coronavirus.utah.gov, which is where all of the information can be found, accurate information on where to get tested, what symptoms are necessary, what are the case counts for today, as we update those every day. Everything that you need to know, what are the regulations around moving from red to orange if I own a restaurant, or if I have a gym. What are the expectations for those that are over the age of 60 or have an underlying health condition. All of those can be found at coronavirus.utah.gov. And so we have tried as best we can to use social media in real time to respond to bad information that's out there, as well as to put good information out there. It's something that politicians have struggled with for a long time. Too many politicians use new media as old media. So they try to take what would be a press release and send it out on Twitter. We understand that that's not how social media works. And so the best communicators now understand how to communicate in different mediums and understand how that medium works. A post on Twitter is very different than one on Facebook. They're sometimes different audiences, but the way they are received and the way they should be messaged are very different. And so having people who understand those differences is critical, and we're grateful that UVU is producing good students who understand that and can help get good messages out, not just for government, but for businesses and others as well. Okay, let's see, two more. From the comms 3570 Crisis Communications, this question reads, what do you consider the greatest success within the state of Utah during this crisis? And conversely, what is the biggest opportunity for improvement? Wow, this is one I haven't had a lot of chance to think much about, but I guess our greatest successes would be the way we were able to, have been able to build out testing and tracing. We recognized very early on that the only way out of this, and I guess I should be clear, we've had to do kind of social distancing, people staying at home, again, businesses that have been closing down because we didn't have good data. We didn't have good information. We didn't know who had the disease. So this is kind of a sledgehammer approach. We just have to, until we can get enough equipment, enough testing supplies, until we can figure out where the disease is, we're going to have to do this. And so we recognize that to get to a more surgical approach, we needed to build up our testing and tracing capacities. And so we now have the ability to test upwards of 9,000 people a day. And we have the ability, we have over 1,000 contact tracers now, where we had 40 when this pandemic started. Those are people who can, once you test positive, they work with you to find out all of the contacts you've had over the past couple weeks, so we can go and get them tested and then isolate everyone who tests positive for 14 days. It's a really, really big deal. And it's the reason that Utah can move forward and we can start to open things back up, because we have this in place. We're one of the only states that has that ability. We're top 5 for testing per capita, and I think we're number 1 for tracing per capita in the country. So that's a really big deal. What are the biggest areas for improvement? Certainly we have learned some lessons through this pandemic. We plan for these things all the time. Our state Department of Health with our local departments of health, as well as the National Guard, they actually did a pandemic tabletop exercise where we have the best experts in the state and the country and the world thinking through what a global pandemic would look like and how it would impact the state and what decisions we would have to make. And as I've talked to those experts, they undersold it by magnitudes. It was so much bigger and broader and deeper than they ever anticipated. And so as we look to getting back to normal, I would encourage us to look to getting back to a better normal. And part of that better normal is, how do we become more resilient as a state? What are some decisions that we can make? For example, bringing manufacturing of important items, medical items that are going to be necessary in the supply chain, our agriculture. How do we prevent supply chain disruption when global incidents happen like this? Those are things we haven't thought through well enough. We're too dependent on China and others for our personal protective equipment, when we have manufacturers right here in the state of Utah that can do that kind of thing. And in fact, they have retooled to do that very thing. We have a medical manufacturer here in the state of Utah that is now making swabs because there is a global shortage. We have several manufacturers that are making masks, but those are the things that we could have done better and that we will do better going forward as we've learned through this pandemic. And finally, the last question, and I apologize for taking so long on these questions. I hope this is what you anticipated. Our last question comes from Comms 3520, Public Relations and Strategic Communication Case Studies. What were some of the first steps taken to determine measurable objectives for the state's plan in managing COVID-19 on both the economic and health aspect? How has the state followed through to measure the objectives established? So, great question. Again, I'm a huge believer that good decisions are made with good information and good data, and that is the thing that we were lacking the most. And so, from the very beginning, we made sure our data teams were ramping up, that they were working with health experts in the field to try to figure out ways to get us better data. We set up a dashboard and tried to get all the hospitals reporting to that. Now, again, this is no small task. We have 49 hospitals here in the state of Utah, and they are very, very different. Some of them are nonprofits, some of them are for-profits, some of them are actually, some in rural Utah are owned by counties. They have all different reporting mechanisms. Again, some of the for-profit hospitals are subsidiaries of much bigger hospital chains across the country. Getting all of them to report was very difficult. But the cool thing was we were the first state in the nation to get all of them to report because we were very collaborative. And so we set up a dashboard to track everything that we could think of in the state. Of course, we're tracking the number of positives and the number of tests that are being done every day. We're tracking hospital beds. How many patients are hospitalized? How many beds are available? Tracking respirators, ventilators. How many ventilators do we have here in the state of Utah? How many of them are being used? ICU beds. How many ICU beds do we have available? How many of them are being used? Those are just a few of the different metrics that we're tracking. And then, of course, on the economic side, we wanted to look at all the data around economics, and so the Department of Workforce Services has been tracking not just those filing for unemployment, but what industries do they apply to? Are they furloughed, or are they or have their jobs been terminated? So we're looking in great detail at those individual lines, which helps guide our response for an economic recovery. Where do we need to put the economic money that's coming in from the CARES Act? Where is it best positioned to help those that are struggling right now? So those are just a few of the metrics that we're following and that are helping us to make these decisions on when to open up, when to pull back. One of the best parts about what we're doing now is our ability to really localize the data. So we kind of looked at county data and regional data before. Now we're looking at zip code data, so that if we have a hot spot, and we have one in Utah County, we have mobile testing labs that can go down there right now, can distribute information, can start testing people in those areas and find out where the hot spots are and if they're expanding, and make decisions based, again, on a much more surgical approach, so that those that are not as impacted can actually increase activity, while those that are having severe impacts can decrease activity. And we're excited at being able to do that, and again, being one of the first states in the country to do that. All right, I've talked too much. Hopefully that was helpful in answering these questions. I will just end by saying this. The governor says in everything we do, and it's become especially true during the coronavirus, that, and he quotes an old movie, you can look it up sometime. He says, what we have here is a failure to communicate. And at the heart of almost every issue that we've had in the state when we've run into roadblocks or had something that didn't go the way it was supposed to, when mistakes are made, it almost always centers around a failure to communicate. Communications, now we have more tools than ever before in our tool bag to communicate, and yet I would posit that it's harder than ever to communicate because there are too many tools, too many voices, too many sources for people to get information. And so being able to communicate clearly, to cut through that, making sure that we're honest with people, that we're transparent. People can take bad news if we're honest with them and if they trust us. It's when we don't give them the bad news and they find out about it another way that we lose that trust and that ability to really communicate directly. And so what we need more than ever is a generation of people who understand those tools and can utilize them and synthesize them in a way that makes sense to the average person, so that they can feel like they're getting the best information, they're getting it in real time, and that they're able to act on that information information. That's what we're attempting to do. We've made some mistakes along the way, but we're getting better, and we're hopeful with great graduates like the communications graduates from UVU, we'll get even better in the future. Again, thank you for what you're doing. Congratulations on your great work. Please stay safe, and we hope to be back together again soon. Thank you.